All right, we are pretty much done here. Just 30 seconds. 30 seconds, Dr. Santoro.
Okay, sir.
So if you want to start getting her ready
Okay.
to wake up, you're welcome to. How's her blood pressure been? Good?
Being great, sir.
All right, stand by laser or turn off the laser. Again, we'll look at that nerve root right there. It looks beautiful. We're done.
Lights on, please.
Yeah. Any other questions, guys, over there from our audience?
Not yet.
All
We
right.
do have one now, actually.
Perfect. Scope is off, right? Yes.
We have a viewer who's saying, what can I do now? I am in more pain than I was before my surgery, 24/7. I can't sit and stand longer than 10 minutes without needing to lay down. My surgeon is telling me he doesn't think more surgery will help, and he's sending me for more injections. What would you recommend doing?
Yeah, that's great. I mean, that you're sharing your experience. I'm sorry you're in so much pain. The fact of the matter is that we got to remember why people get back pain. And to understand why people get back pain, you've got to understand the causes of back pain. So if you're having back pain, then it's coming from a joint or a muscle or a bone, right? That's like 99.9% of back pain. Joints, muscles, bones. And there's really 3 joints in the lower back. There's the disc, the facet, and the sacroiliac joint. And you've got 5 discs in your lower back, you've got 10 facet joints, and you've got 2 sacroiliac joints. So that's 17 possible sources of pain. Each one of them could produce horrible pain just by itself. So you have 17 potential pain sources, and I'm sure your surgeon did surgery on like maybe 2 of those 17. So it's not uncommon for people after surgery to have pain coming from a different area in their back. As a matter of fact, in my own patients at Deuk Spine, we'll see back pain coming from other areas, whether it's muscle, joint, or bone, probably in almost 50% of the patients. And those people generally usually just need physiotherapy, hold pressure. They need therapy to strengthen the muscles and recondition the muscles, to stretch, to get rid of muscle spasms and inflammation in the muscles around the spine. Sometimes they need joints treated. That's where you get a facet joint injection, remote from where you operated usually. So the point I'm trying to make is there's a lot of reasons for people to have back pain. The answer is you want to get it fixed. You want to get it fixed. So the question is, how do you do that? Well, I would encourage you to have Deuk Spine Institute do an MRI review for free. You know, we can look at your post-operative MRI, and I personally look at them, and I will have a conference with you, a video conference, and I can tell you where your back pain's coming from, usually with the MRI and a video conference. So I'd be happy to do that. There's no charge. It's free for everybody in the world that wants to do it. We don't charge for it, and I think it would be very helpful for you to get a free second opinion. So that would be my advice to you to do. Other than that, if you don't want to do that, then I would work with your surgeon and just see what they think is causing the pain. But if they ever tell you, I don't know, or they ever tell you, you know, it's in your head, or they ever tell you just live with it, do not. That's when you come to Deuk Spine Institute. We'll fix it for you. Happy to do it. You know, pain is fixable. 98% of the time it's curable. And it's just a matter of getting the right joint, the right muscle treated, and it's just really about making the right diagnosis, okay, and then properly treating it technically. So don't give up hope. It's certainly fixable 98% of the time, but you may have to come here and have us do it for you. That's what I'd recommend. All right, our blood loss is 5 mils, no complications, and this I could not get to L45. So DLDR, right, L5S1, and aborted L45, due to anatomical constraints. So if this patient still has a problem afterwards at 045, which I think is the minor problem anyway, and I didn't even get a chance to test it, but if there is, then we're going to have to do an open surgery because I could not get to it from all the fusion mass there laterally. I'm going to head over to the conference room and I'll answer some more questions for our audience, Zach. But I just want to say thank you, everybody. Great job. Thank you, Dr. Santoro. How close is she?
We are just waiting for the RFA.
Yeah, we got to get him in here. Okay. Yeah, you should call earlier, okay? So there's no delay. All right. All right, Dr. Deuk Machen back with you, and we've just completed Deuk laser disc repair of L5S1. This is a patient who had a spinal fusion done in another state. This was several years ago. She has bad scoliosis with twisting of the spine, and her main problem, her pain, was at the lower back, just below the fusion, above her butt crack, which is the L5S1 level. And on MRI scan, clearly they did not do a fusion at L5S1. They went from L2, 3, 3, 4, 4, 5. They did not fuse L5S1, which is fine. It was expected, probably because there was no problem there. But over the years, she's developed an adjacent herniation at L5S1, a herniated disc. And that's where her pain source was, the herniated disc. So we went in today and we did a Deuk laser disc repair at L5S1. Now, one of the things her prior fusion surgeon didn't do is take out her discs. And when you don't take the discs out of someone's spine and do a fusion, there's always a chance the disc can continue to cause pain. And that was one of my concerns, is that the L45 disc was causing pain, because the surgeon never took the disc out, and because there was a possible failed fusion and pseudoarthrosis at L45. So I was concerned about the bulge disc that was there, tried to access it during the surgery. I was unsuccessful at getting there. The reason I was unsuccessful is because the surgeon that did her fusion did so much muscle damage and put so much bone graft laterally that it blocked the access to the foramen. So the needle was hitting bone that he had put there from the fusion mass that's posterior, and it just basically prevented me from getting into the foramen to fix the disc at L45. The good news is that her pain seems to be coming from L5S1. We tested that disc during surgery by injecting dye in it. We call it a discogram, an evocative discogram. And that procedure actually showed that her back pain is coming from the L5S1 disc. Now we're also doing a rhizotomy to treat her facet joints, because we want to make sure we treat both the facet joint pain and the disc pain that she's having before she leaves. So this patient's having a Deuk laser disc repair that includes a facet rhizotomy at the same time as we repair the disc. All right, we apparently have a few questions, so I'm going to get to those questions now.
Our first question is, if I've had drop leg for 2 years since my microdiscectomy, is there any hope that I'll regain full function of my leg, or has the sciatic nerve been damaged beyond repair?
All right, so can the audience see this question?
Yes.
That was quick. Is that fresh? Wow. So the question is, and it's a common question, and I appreciate the person asking. They said, look, I have weakness in my leg from a pinched nerve. I had a microdiscectomy 2 years ago, and I still have weakness. Is there any chance I'm going to get strength back? So the answer is simple. Number one, did the surgeon do the microdiscectomy properly, or did they leave the nerve pinched? If they left the nerve pinched, and I were to go in there today and unpinch it, then there's 50-50 chance your strength will come back. So the first question I would want to know is, let's get an MRI, let's look at the nerve, and let's see if it's still getting pinched by a herniation. It's very common for spine surgeons to not get the herniation out for whatever reason. And I'll tell you the reasons are usually because they just don't do the job properly. They get lost, they're not sure where they are, they're just not well trained, they're not well experienced, and they, unfortunately, I would say about 70% of the time they leave the herniation in there. So there's a very good chance that your symptoms of weakness are due to a nerve being pinched that's pinched because the surgeon never did the job properly. The way you know your surgeon did the job properly is you wake up from a microdiscectomy and your leg pain is gone and your strength is improving a little bit. Maybe you may have numbness that lasts 6 months to a year. That's normal after you unpinch a severely compressed nerve. So, but the pain should be gone and you should feel significant amount of improvement, okay, when you wake up. If that happened with your surgery and now you're getting weakness coming back, then you have a new herniation and that's fixable with surgery, so it should help your nerve. The other thing I'd want to get is a nerve test, and I don't want that done anywhere but at Deuk Spine Institute. There's lots of doctors that will do nerve tests to get the money, and they do a horrible job and they give you nothing in exchange that's worthwhile. So you want a nerve test done by an experienced physician who does electrodiagnostic medicine and will be able to tell us if the nerve is still getting pinched. And what we're looking for specifically is active denervation, signs of active denervation. Those are objective findings on a nerve test, and that includes specific types of waveforms that you see in the nerves when you put the electricity through them to test them. You'll be able to tell if the nerve is still being actively denervated. If that's the case, if there's active denervation, then that means your nerve's still getting pinched actively right now, which means it's fixable with surgery. So what I would say to you, for the person that said, I've had a foot drop for 2 years since my microdiscectomy, is there a chance I can get my function back? The answer is yes, 50% at this point. Without knowing anything more, there's a 50-50 chance. But you have to have the surgery done by a very competent surgeon who knows what they're doing. The other thing I would say is that if you went into the surgery and you had no weakness and you woke up from the surgery and now you have weakness right afterwards, that's concerning that the surgeon may have cut the nerve. And I've seen it happen with the best neurosurgeons in the world, cutting nerves. So it can happen to anyone. It's never happened to me, and I've never cut a nerve ever in 22 years. That's because I'm extremely careful with how I do my surgeries. And I treat each and every single surgery and every patient like I'm operating on my own back. And so it has to do with a level of, vigilance and awareness, and also having the right equipment, the right microscope during the microdiscectomy. There are surgeons who don't use a microscope. They use loupes, which are little magnifying glasses on their eyeglasses. They're horrible, and the illumination is horrible. They can't see what they're doing. There are surgeons who don't use loupes or a microscope. That's the worst case scenario. There's lots of them because the hospital won't buy them a microscope to use, or because they can't spend $2,000 on a pair of loupes. So they end up operating basically blind on your back. And I will tell you, a microdiscectomy is a hard surgery to do. You must have the best equipment, the best microscope, with the best optics, the best illumination, and you have to have a really good experience bank knowing what you're doing. And to have that combination is about 5% of spine surgeons around the world, 5%. So there's a 95% chance where you go, you're getting poor care, you're getting risky care, it's risky to you, and there's a very high chance you're going to have surgery and not get any better because they didn't do the microdiscectomy right. So this is an educational program. This broadcast is about teaching the public the truth. So I've taken off the gloves, and I'm basically showing you the truth about the spine surgery industry. And the truth is that I truly believe 95% of spine surgeon microdiscectomies are done incorrectly. And that's why there's so many people that have back surgery that are still in pain, that still have a problem, is because those surgeries aren't done right. If you want your surgery done right, you need to go to somebody who can do it right. And that's not just the doctor, that's the facility, that's the surgery center or hospital. They have to have the right equipment. They have to have the right staff. They have to have the right medications. If you go somewhere that doesn't have all those things perfect, and you don't have the right surgeon, you're not going to have an optimal result. You're going to have a bad result. And that's what it sounds like we have here with this person. They've had a bad result, but it's very common that I hear this. So what I would recommend you do is get your butt over here and let me evaluate you and figure out what's going on. But there's a 50-50 chance right off the bat that your problem can be fixed or improved upon with the right surgery. Next.
What is the difference between a laser disc repair and an endoscopic discectomy?
What's the difference between, the next question is, what's the difference between a laser disc repair and an endoscopic discectomy? There's a huge difference, okay? So the way the question is asked, it leaves a lot open for interpretation. But the fact of the matter is a discectomy is removing a herniated disc. A Deuk laser disc repair, and by the way, there's only one laser disc repair in the world. That's a Deuk laser disc repair. It's been peer-reviewed and published. I'm the first surgeon in the world to ever describe this technique, and it's very unique. It's unique because I do something that no other surgeon in the world does. It's called a annular debridement. So what's the difference between a Deuk laser disc repair and a endoscopic discectomy? Endoscopic discectomy does not do an annular debridement. Endoscopic discectomy just takes a disc piece out. It's called a discectomy. Discectomy. Ectomy means to remove. You're removing part of the disc. It has nothing to do with debriding the annular tear. That's a completely separate procedure. So the Deuk laser disc repair, my procedure, is an endoscopic debridement. And it's the endoscopic debridement of the annular tear that gets rid of back pain and neck pain. And that's why other surgeons are not successful at getting rid of back pain and neck pain in their patients. And that's why they don't even try to get rid of back pain and neck pain in their patients, because they can't, because they don't know how to do an annular debridement. They can't see the annulus to debride it. They don't have the laser to debride it, which you must have to debride an annulus. You need a laser. So if your surgeon is not doing a laser annular debridement with endoscopic assistance on your neck or back, you are not going to get rid of your back or neck pain from the disc, okay? And so that's why you have to come to Deuk Spine Institute to get proper surgery done. If you want groceries, you go to the grocery store. You don't go to the shoe store to get groceries. If you want to get rid of your back and neck pain, okay, you can go to the shoe store and they'll tell you they can get rid of your back and neck pain by giving you the right shoe. That may work in like 0.1% of the population, but that's not going to work 98% of the time like going to the right place does. So when you go to Deuk Spine Institute, you're going to the very best, and you have the highest chance of getting rid of your back and neck pain, period. And if you go elsewhere, you're lowering your chance dramatically. That's really what it comes down to, is you're not going to get the best care everywhere. You have to be very selective about where you go to get the best quality of care, and that we're not all the same. Deuk Spine Institute is not even close to the average of where you would go to get your neck or back fixed. Our results are much, much, much better and much safer. And everybody seems to think, oh, we just got to go to a spine surgeon. No, you're wrong. A spine surgeon by themselves can do absolutely nothing for you. Just take that spine surgeon and sit in front of them and tell them to fix your back. They can't. They have to take you to a facility, either a hospital or a surgery center. Now you've added another variable in the equation. That hospital or surgery center, you got to start asking yourself, do they have all the best equipment? And then you got to ask yourself, does my surgeon really know how to use that equipment? So those are, I'm telling you right now, you're going to find tremendous variation in the world of spine surgeons and facilities. But if you want the best facility with the best staff, the best equipment, the best medication, and you want the best surgeons in the world to fix your back or neck, they're going to give you crazy good results. That's why we have crazy good results at Deuk Spine, is because no one else can do what we do. That's the whole point. And why do we broadcast? Because I'm tired of seeing people fall into the spider web of other practices where they end up getting treatments that don't work, that hurt them. They come out worse than they were going in. And that does not happen at Deuk Spine Institute. If our patients have a surgery and they have pain afterwards, we figure out where that pain's coming from. There's always a reason for that pain. And so it's just a matter of being diligent and uncompromising on your values and saying, I'm going to figure out where this patient's pain's coming from, and we're going to fix it. So I already know where pain comes from. I already know all the causes of pain in the back and neck. And it's just a matter of figuring out which one that patient has. That requires diagnostic tests. And so do we have the diagnostic tests needed to do that? Absolutely. Do all the hospitals and facilities have the diagnostic tests needed to figure out where your back and neck pain is? Absolutely not. They don't. Most of them don't. So you may say, well, my hospital has an MRI. You're right, they have an MRI. But guess what? The radiologist reading that MRI is horrible at reading spine MRIs and actually blows off all the herniations and says it looks fine. It looks normal, but it doesn't. There's herniations there, and that herniation is causing the patient's symptoms. So people have to stop thinking about spine care as being equal across the board, and wherever I go, I'm getting the same care. They've got to understand where they go makes a big difference in their outcome and how they're going to do. Huge difference. And at probably 95% of spine centers around the world, people that treat spine problems, they don't do it right. All right, they don't do it right. That's pure and simple. And they don't do it right not because they don't want to do it right. They may have every intention of doing it right, but they don't have the equipment, to do it right. They don't have the medications to do it right. They don't have the experience and technique to do it right. And those are things that are important, and people need to understand that. Next question.
Do you recommend removing fusions if the spine has begun to fuse on its own?
So the next question is, do I recommend removing fusions if the spine has begun to fuse on its own? So what I assume you're saying is, if I go in and have screws and rods put in to fuse my spine, and once it's fused, should I get them taken out? The answer is no, you should not get them taken out. There's no reason to put yourself or anyone put themselves through a second surgery to take out the screws and rods or metal plate after the spine is fused. Those implants are designed to be what we call low profile, meaning that they don't interfere with your life after the fusion has occurred. That's why we leave them in. The terminology for them is called internal fixation. Because in the old days we used to use external fixation, which is back braces and neck braces, but external fixation doesn't work to hold the spine stable while it fuses, so the failure fusion rate would go very high. It would be like 80-90%. Then we started putting these screws and rods internally. We call them internal fixation, and they're all the new screws and rods, the latest screws and rods in the last 20 years are all designed to be very low profile so they don't cause any problems after the fusion's done. You really don't need to have them taken out. The only time you need to have screws and rods or hardware taken out from a fusion is, number one, if your fusion gets infected. So if there's an infection in your wound and you have hardware in there, it's very hard to get rid of the infection with antibiotics if you still have metal in your neck. So what we typically do is we'll try to get rid of the infection by treating with antibiotics, doing a surgical debridement, putting a drain in for a few days. We do all those things. And if the patient's infection clears, great, we leave the hardware in. But if it doesn't clear and you find yourself repeatedly over and over again debriding and draining, you need to get the hardware out, but you have to wait till the spine is fused. So that's not one reason to take the hardware out after a fusion is taken over, is do you want to get rid of basically the place where the bacteria grow is on the metal. They grow on the metal because there's no blood supply to the metal. The metal is just an inanimate object, and bacteria grow on inanimate objects very well. They produce a slime coat, and that slime coat basically blocks the antibiotics coming into the muscles next to them from getting onto them and killing them. So they develop a biofilm. It's really a biofilm. It's basically a slimy biofilm. It's a polysaccharide layer, and it basically blocks like a barrier, like a wall, like a little wall that covers them and blocks them and protects them from the antibiotics. So if the hardware instruments get colonized by bacteria where they're growing and living on it, reproducing on it, and you can't clear the infection, that's the best reason to remove hardware. The second reason to remove hardware is if a patient has a fusion and they develop adjacent segment disease, then they get a second fusion. A lot of times we have to take the hardware out of the first fusion so we can put the second fusion's hardware in. Otherwise, the first fusion's hardware blocks the placement of the second fusion's hardware. So that would be a second reason to take hardware out. Aside from those two reasons, there's no other reason to take hardware out. People that believe the hardware is causing pain, it's not true. Hardware doesn't cause pain. It's actually movement at a joint that's painful joint that causes pain, or muscles can cause pain. But I rarely ever see hardware causing pain. I'd say less than 0.1% of the time. So I would recommend you get a second opinion if your surgeon's recommending removing the hardware to treat pain. And I'd be happy to look at your situation. As I mentioned earlier in the broadcast, Deuk Spine Institute offers a free review of your MRI to give you our opinion about what needs to be done and what's causing your problem. We even do a video conference after the MRI review where we can spend 10 minutes on the phone talking to you about what we think's wrong and showing you your MRI, so we're educating you about your problem. I truly believe the most important tool, most powerful tool in medicine is educating the patient about what's wrong with them and what needs to be done, what their options are to fix it. Like they have choice, and what are those choices and what's the pros and cons of each choice. Patients should be responsible for making decisions about their own care unless they're unable to, where they would have a durable power of attorney or surrogate. Long story short, The doctor's job is to make the right diagnosis, educate the patient about the diagnosis and treatment options, and then to execute what treatment options they are able to based on their specialty and training for that patient, should the patient choose to do so. So, long story short, what I'm getting at is a doctor's first responsibility is to make the right diagnosis. And in your case, I think your doctor's made the wrong diagnosis if they're telling you to remove hardware to treat pain. The most likely cause of your pain is another disc problem, some above or below your fusion, or a hardware problem, or a joint problem. You know, you could have some loosening of the hardware in case you need another fusion. All right. I hope I answered the question for you. Next question.
After surgery, I was hospitalized for 10 days with unbelievable pain. It took me 4 days just to get up to use the bathroom. I still think there is something pressing on my nerve, but there's an MRI, and my doctor says there isn't anything there. I can still argue.
All right, so we have somebody who's talking about their personal experience with spine surgery, and I've got to say, this is sad. It really breaks my heart to hear these stories, because I don't think any human being should suffer like this, especially now that I know it's completely unnecessary to suffer after back surgery like this. So this is a person who had back surgery. They were in the hospital for 10 days with unbelievable pain. That unbelievable pain, my friend, was completely unavoidable. It was completely avoidable, by the way, just so you know. And that's why we do this broadcast, so people know that they have a better option, a better way of doing it. And so I know that doesn't help you right now, but the reason we do these broadcasts is not to help you, it's to help everyone. And so I have to use what you've gone through as an example for everyone to learn from. And that's why I'm pointing it out, not because I'm trying to make you feel bad about your decision. I feel horrible for you and what happened, and nobody should suffer for 10 days in unbelievable pain in a hospital. That's why I developed the Deuk laser disc repair surgery, because our patients have no pain afterwards. Their pain level is a 2, and we have them on Tylenol. So imagine having that surgery and having Tylenol only and not being in pain, but a 2 out of 10 pain after your surgery for a day, and then it goes away. So that's the future of spine surgery. What you had done is barbaric. It's old, and it highlights exactly what I just spent the last 10 minutes talking about, is that every surgeon and every facility does their surgery differently, and that vast majority of them think it's okay to make a patient suffer for 10 days with unbearable pain. And these surgeons disgust me, because they're lazy, they're not willing to learn new technique, and I'll be honest with you, if they are going to put you through 10 days of suffering and misery like that, and they could refer you to another doctor like me who does it much better, where my patients don't go through 10 days, they only go through 0 days and 0 minutes of suffering like that. If they're too selfish not to send you to me, which I'm a much better surgeon than they are clearly, then that disgusts me, because a doctor's first responsibility is to their patient. Now, granted, you need back surgery, and probably did. I don't know that for sure, but I assume you did. But you should get the best back surgery. And doctors have a responsibility to their patient to learn the best back surgery and learn how to do it properly. So I broadcast every single one of my surgeries live so the doctors can learn too. It's not just for potential patients. It's for all healthcare providers. It's for hospital administrators. It's for surgeons. It's for nurses. It's for patients. It's for everybody. Because I want the world to see there's a better way to do this than to have patients laid up in a hospital suffering with horrendous pain after a back surgery. Those are the old days. That was 30 years ago. All right? And a lot of these doctors don't want to spend the time to learn the new technology or treatments. It's completely unnecessary. And basically, because of their laziness or slothfulness and ignorance, you're paying the price. So, number one, I'm angry that you're going through the suffering. It upsets me. It upsets me that anyone would suffer like that after spine surgery. So that's number one. Number two, you're still in pain, getting up, you feel like there's a problem. You're right, there's a problem. There's absolutely a problem. Any doctor that would put a patient through 10 days of suffering of pain after a spine surgery clearly doesn't know what they're doing, and their surgery isn't being done right. So I have no doubt something wasn't done right. So if you want my help, what you're going to need to do, sir, or ma'am, whoever you are, you're going to need to send your MRI scan in to Duke Spine Institute for a free MRI review. I will look at it and I'll figure out what's wrong. I'll need an MRI done after your surgery. So if you haven't had one done yet after surgery, you need to demand one from your physician. Tell them that you want an MRI. Also, you need a CAT scan. So I want an MRI and I want a CAT scan. All right? And if you can get the MRI and CAT scan over to Deuk Spine Institute, we do a free review, no cost to you. And I'd be happy to do a video conference with you and sit down and go over your MRI and CAT scan over the computer where you're home and we're here in Florida, and I'll review your findings and show you why you're having pain. I can do that, and I do it for free for anybody that wants me to, because that's part of helping my community get better and heal. And that's my job. That's what I do as a doctor. I want people to be fixed and out of pain. And it just kills me to see these horror stories like yours. But I'll be honest with you, they happen all the time. That's most spine surgeons put their patients through that horrible treatment. Yeah, I'm not happy about it, and you shouldn't be happy about it. So I'm sad to see that you can hardly walk, but get your films over to me immediately, or just come over here to Florida, to Brevard County. You fly into Orlando. It's a 45-minute drive to our clinic, and you know, we can help you for sure. Whatever your problem is, we can figure it out. So you're going to want to talk to patient services at Deuk Spine Institute, speak with Lauren, she's the head, and coordinate a plan with her. One final question we're going to answer.
If pain injections only help for a short time, do you recommend I continue to get them?
All right, so somebody says I'm getting pain injections, but they only help for a short time. Do you recommend I continue to get them? No, I don't recommend you continue to get them. Pain injections are supposed to be, if you're talking about epidurals, they're supposed to be the first injection gives you 50% relief. The second injection, you do the second injection. Yeah, the second injection should give you longer term relief, like literally 3 months, 6 months. If you're not getting a minimum of 3 months and hopefully more than 6 months relief from the injection, you shouldn't be doing them anymore. So it's time for surgery to fix your problem. And we can do that at Deuk Spine Institute. I just need to see your MRI and do a video conference with you. All that can be arranged for free through patient services. So if you have the app downloaded on your phone for Deuk Spine Institute, then use the app to submit your MRI for review. There's a section where you can submit your MRI for review in the Deuk Spine Institute app. If you don't have the app, then download it and submit your MRI for review. If you don't want to download the app, that's okay too. Just go to the website, Deuk Spine Institute, www.deukspine.com, and submit the free MRI review. Okay? So that's how you get your MRI to me. I'll look at it and figure out what needs to be done to fix your problem. But if you're doing pain injections and they're not fixing your problem permanently, then you shouldn't be doing them anymore. Pain injections involve injecting steroids into your body. That's okay for a few times, but you shouldn't be doing that for more than, say, 6 months or even a year. For sure, you should get it fixed. Can you get your problem fixed? Absolutely. Don't believe anyone that tells you you can't. That doctor that tells you it's arthritis, or that doctor that tells you it's not fixable, that doctor is wrong. And you need to find someone that can fix it. And Deuk Spine Institute can fix it. So that's why we encourage people to make the trip. It's a trip of a lifetime. It's better that you make a small trip for a few days and get your back or neck fixed than to suffer with that problem the rest of your life, or worse yet, to have an incompetent surgeon do a procedure and give you a complication that you shouldn't have had. And I'm telling you, that happens all the time. So you're going to have to travel for this, you know? I tell my friends, they live in Florida, they say, oh, we love Europe. Europe's so amazing. I love to go to vacation in Europe. Well, you can't vacation in Europe unless you vacation in Europe. Okay, you got to get up and fly over there, and you got to stay in a place in Europe, and you got to live in Europe for that week that you're on vacation. You can't have a European vacation in America. You know what I mean? You got to actually travel there. So it's the same thing for getting your back or neck fixed. If you want to get your back or neck fixed properly with a very low risk of any complications, you've got to go to a facility or a surgeon, a center that treats those problems the best in the world, so you have the best results. And that's Deuk Spine Institute. Any more questions? All right. Well, that was a good, interesting case. Again, it highlights the fact that the Deuk laser disc repair is an amazing surgery, but it can't work 100% of the time. So in this case, I couldn't get into the 045 disc. But I'm willing to bet that this patient has 95% relief of her back pain from the surgery. And the reason is I don't think the 045 was that bad. I don't think it was a major part of her problem. Once I did the discogram, I knew that L5S1 was the big part of the problem. And that once I fixed L5S1, that she was going to have good relief because she had 8 out of 10 concordant pain. Concordant means that's her typical pain. So I feel really good about the result, even though I had to abort L45 because of the prior fusion. All right? So it was a good session. We have another patient coming up shortly, and we're going to do an L5S1 Deuk laser disc repair. This is a young lady who injured her back in a car accident. She has a herniated disc at L45 and L5S1. She wants to just treat the L5S1 at this time. She does not want me treating L45. I offered to do both at the same time. So we're going to go ahead and do her surgery next.